And I get this pain. Sometimes it's a sharp pain right here in my abdomen.
I seem to feel bloated and gassy, especially after drinking or eating.
I've had diarrhea lately, alternating with constipation.
These symptoms, along with the possibility of mucus in your stool, are all indications of irritable bowel syndrome. Nearly half of all digestive complaints seen by doctors are caused by irritable bowel syndrome. Sometimes it is also referred to as spastic colon or nervous stomach.
While the symptoms can be very uncomfortable, irritable bowel syndrome is not a disease but a disorder, and it does not lead to cancer. There is no relationship between irritable bowel syndrome and ulcerative colitis, which is an inflammation of the colon. Unlike ulcerative colitis, irritable bowel syndrome almost never requires surgery.
Normally, food moves through your digestive tract without any trouble or pain. It's taken in the mouth, chewed into smaller pieces, and sent down the esophagus to the stomach. Here, it's mixed and churned with powerful digestive juices. The liquefied food enters the small intestine, which extracts useful nutrients as the food passes through. The undigested material that remains is then forced into the large bowel, or colon. Here, some of the water is separated from the material, and what remains is formed into a mass. Contracting muscles in the colon periodically move the mass, or feces, into the rectum and out through the anus. This normal function is changed when you have an irritable bowel. Trouble starts when your intestines tighten and spasm. These tightened muscles cause pain. This pain may be increased if there is gas trapped inside your bowel, creating more pressure. These muscle spasms are also the cause of constipation. With the muscles in spasm, your colon cannot produce the normal movement needed to push out the feces. This delayed removal of the waste matter causes it to give up too much water, and the stool hardens. The stool may be compressed within the colon into hard pellets that are passed with difficulty. Diarrhea occurs when these muscular contractions are so massive and so rapid that the residue is pushed faster than normal toward the rectum. This rapid movement does not allow enough time for water to be extracted by the colon, so your stool is loose. No one can say for sure why you have irritable bowel syndrome. Most likely it's triggered by a number of factors. Stressful situations and the way you react to them is the most common. But the trigger could also be irritating foods, infectious agents, maybe even heredity, or a combination of these. All of these can upset the normal function of your digestive system, especially if your intestines are sensitive to them.
Like other chronic lifelong disorders, such as high blood pressure and diabetes, irritable bowel syndrome can be managed even if it can't be cured. The key to successful managing of your irritable bowel syndrome is your cooperation with your doctor's treatment program. The first step is diet.
You'll begin by keeping a daily log of all the foods you eat. Using this log, you can begin to identify those foods that cause you problems, and in consultation with your doctor, reduce or eliminate some of them from your diet. Dietary sensitivities are highly individual. For example, milk and milk products like butter and cheese, and other foods such as beans and cabbage may cause gas and bloating in some people. For others, coffee causes diarrhea. Your doctor may give you a diet designed to soothe your irritable bowel. High-fiber foods such as lettuce and bran can be particularly beneficial because they add bulk to your stool, making it softer and less painful to pass. Bulk agents may be recommended to normalize the consistency of your stool, whether you are having diarrhea or constipation.
Another important goal of your treatment program is learning to deal with stressful situations. If you're under emotional pressures at the job or in the home situation, think of ways to reduce or to avoid these pressures. Try to develop a more relaxed lifestyle. Discuss these possibilities with your doctor.
Relief from stress could be as simple as pursuing a hobby or some regular activity that is enjoyable and relaxing. Management of stress also includes getting enough rest. If you cannot manage your stress as well as you'd like, your doctor may recommend certain relaxation techniques, or counseling may be recommended for a time. A heating pad or hot water bottle placed on your stomach may give some relief from any pain you may have. Bowel habits are different for different people. Any stool that is passed without too much difficulty and is not excessively hard or watery is okay. A regular bowel habit does not have to be once a day. In fact, there is no danger in waiting 2 or more days for your bowel to empty if that is normal for you. You should discontinue taking all laxatives and other stimulants that are not specifically prescribed for you by your doctor. If you're a smoker, your doctor may ask you to stop smoking because nicotine can cause the colon to go into spasms. Your doctor may prescribe antispasmodics to relieve the spasms in your colon, or special laxatives, tranquilizers, and antidepressants to help you relax. Of course, you can't expect immediate results. You've probably had irritable bowel syndrome for some time. But by following your doctor's course of treatment and actively working to reduce stress in your daily life, you can overcome the pain and discomfort of irritable bowel syndrome.